CEO Oldfield and I are here today to talk about what actions we are taking to make our emergency departments better. These actions will improve care for Nova Scotians and support frontline healthcare workers. To be clear, most of these improvements have been in the works for some time. As much as we want change to happen overnight, many months of work have gone into what's happening today. Many of these actions are immediate, and others will take a few weeks for recruitment. These actions are not exhaustive. We know that there is more to do. We know that we need to continue to make the necessary changes and investments required to fix our healthcare system. Our healthcare system has been neglected for years. For almost my entire career as a registered nurse, government after government of all political stripes has focused on efficiency and cost containment in healthcare, despite calls from experts and healthcare workers that the system was in trouble. They were warned that our workforce would retire en masse. Chronic disease rates were increasing, and our proportion of the population that was elderly would grow. And the lack of proper infrastructure and human resource investments would leave us in the place we find ourselves in today. But nobody listened. The needs of the system have expanded and changed, but the system has not. Cost containment and lack of long-term planning have created scarcity in the system. Our government was elected to change that. We knew fixing healthcare would take money, and we knew it would take time. Since being elected, we have worked with healthcare workers, industry partners, innovators, researchers, and communities to begin the healthcare transformation and address all the challenges that have been ignored for years. We are investing, and we are working tirelessly to reverse the tide brought on by so many years of neglect. Yesterday, the Premier and I met with many leaders in the healthcare system in the province. The Premier told the gathering we need faster change and we need to be bold. The past is not the future. And it is our shared responsibility not only to improve healthcare for Nova Scotians seeking care, but also for those working on the front lines. Emergency healthcare is critical to Nova Scotians. We are building a healthcare system that is ready, responsive, and reliable. Nova Scotians are worried right now. I know that, and I understand that. I want everyone to know that we are moving fast to make things better. In order to take strain off emergency rooms, we also need to act quickly to enhance primary health care so that Nova Scotians have options other than the emergency room to receive the care they need. Recruitment and retention, leveraging technology, and developing care teams where all providers use the full scope of practice are necessary. Today, we are announcing a series of new initiatives based on what we've been working on over the last number of months. Based on recent events in the emergency rooms in the province and under the Premier's direction, we have accelerated these actions. Our actions today focus on two areas. The first, improving emergency room care and safety. The second is diverting lower acuity patients away from the emergency room to the right provider at the right time. The following are actions being undertaken to ensure those with the most urgent care receive care first. A team led by doctors that will focus on getting patients out of ambulances and into the ED as fast as possible. Staff assigned to provide care and support in waiting rooms, which include patient advocates, physician assistants, and nurse practitioners in emergency departments. More care delivered virtually to patients at emergency departments with less urgent needs. Real-time data available on where beds are available across the system and what tests or other actions are needed to get patients well and home more quickly. We are implementing actions to help ambulances arrive more quickly, which includes paramedic training at more campuses, a tuition rebate for paramedics who agree to work in the province for at least 3 years, a second air ambulance to handle routine transfers for tests and treatment between Sydney and Halifax and Yarmouth and Halifax, more funding to support medical first responders to be trained. Actions to give people more places to receive care and reduce the pressure on emergency rooms include support for new and existing collaborative family medicine practices so that they can see more patients, more services in pharmacies, longer hours for virtual care appointments, and enabling out-of-province physicians who are licensed here to offer care. More mobile primary care, mobile respiratory clinics, and urgent treatment centres, and a new phone app known as the Digital Front Door that will help people find the right services for their needs and where they are offered. There is more to do. We need more people in the system. We need to recognize and help the healthcare workers we have. We need to invest in modern facilities and cutting-edge technology. Action for Health is built on the voices of healthcare workers. We consulted them, built a plan, and over the course of our mandate, we'll deliver this plan. Premier Houston has repeatedly said he will give healthcare everything he's got, and that's why we are taking what we have been working on and moving it forward quickly. We have made record investments. We have increased training spaces for nurses and physicians. We have increased wages for continuing care assistants and hours of care for seniors living in long-term care. We have announced a common-sense approach to increasing health infrastructure in HRM. We are leveraging technology and innovation to deliver care and expanded options for mental health services throughout the province. Today, we have announced more action, and we will continue to act and implement solutions for healthcare. Thank you.
Now take questions from media. Go ahead.
I'm sorry. Go ahead.
Thank you, Minister. I want first to echo the condolences to the families of Alison Holthoff and Charlene Snow, and our deep concern around emergency care in the province. As the Minister has said, the healthcare system is changing, for us at breakneck speed. We do have the three ingredients for meaningful change: necessary funding, experience around the province, and we have political will. I did attend the meeting yesterday with the Premier, the Minister, and healthcare partners. The Premier spoke, and more than once, of urgency, and no one disagreed. We certainly have felt this urgency at NSH. And in that regard, I want to thank all staff, especially those on the front lines who are working in very challenging situations. They are doing their very best to provide care to Nova Scotians across the province. It has been a tough couple of years for them. Imagine a workplace where there are not enough staff and you have to give 120% every day, all the time. And it has been going on for nearly 3 years. And at the same time, your workplace is changing very rapidly, very dramatically. My hat goes off to them every day. As Minister Thompson has just said, they were neglected and ignored, but no longer. I do hear from frontline workers every day. Every day. I've also heard from them during the tour that we did in September 2021, and again during the current community discussions, October, November, December, January. The Action for Health plan is built on what we have heard from healthcare workers. Some of the ED actions we are taking today have come from staff ideas. We are taking bold actions on behalf of Nova Scotians and those who work at the Health Authority. We are embracing innovation and technology. It's true the healthcare system was set up decades ago. It was built in a completely different era. And aside from technological advances, it really hasn't changed that much. That is not our future. No one person can move this mountain by themselves, and we're looking for more help. If you're a nurse or a nurse practitioner or a physician or any other healthcare worker who's looking for work, rest assured, I'm looking for you. Let us know that you're available. Because we can do it if we all pull together with a common goal, a system that is ready, responsive, and reliable. Thank you.
Okay, now we'll take questions from the room.
Can one of you talk about the immediate changes that are going to happen in emergency department waiting rooms to ensure that patients who need speedy attention get it, even if they're waiting several hours? How is that going to change?
So there's a few things that I can point to. So number one, there is an individual who will be there to provide comfort and support. So often we hear from patients that they don't know what's going on. Lower acuity patients is what I would say, people who are waiting for longer periods of time. So offering comfort and support and communication is really essential. So that may be a warm blanket, that could be water, and working in between the emergency department and the waiting room so that patients understand what's happening, number one. There will be also some additional clinical support to make sure that patients are re-triaged in a timely way, as they were always intended to be, recognizing that emergency rooms are quite compressed at this time. I would also say, if you will indulge me, that there are things happening in other departments that are going to support the emergency rooms. Emergency rooms are our point of access. But when you look at it, we have primary care and community, ideally. We have a point of access in the emergency room. If you're admitted, we have this period of time where you're cared for, and then we have the need for discharge. So we need to look at the primary care teams immediately. How do we provide more access to folks, whether that be through virtual, to prevent people from going to the emergency room, whether that be through enhanced primary care teams so that people are working amongst their scope. So we talk about scope, sorry this is a long answer, but when we talk about scope, currently we can maybe see this many people, but when we expand the scope of people, it allows us to see this many more people, right? And then finally, I would say the work that's happening in seniors and long-term care is absolutely essential to what happens in our emergency departments. Often we have patients who are ready to be admitted who can't be, absorbed into the hospital because, one, there's not enough beds in the hospital, and there's also not enough beds in long-term care. So this is the transformation that we speak about. So today there are immediate things to support that access point. We want patients to have good communication, to have comfort and support, and increased access to clinicians like the Float MD. But as well, we also need to look at the system in terms of those medium and long term, so how we create an outflow so that patients can get care inside.
Minister, what's your expectation on when Nova Scotians who need emergency care will see lower wait times in the ERs?
So as these interventions scale up, I think that they will see immediately that there will be changes. So as an example, there may be people, to the point, if someone is triaged at a lower acuity number of 4 or 5, the option will be available to them. We can say, if you are willing to work through the virtual care process, because maybe not all are, this is what your wait time, we anticipate your wait time to be. However, if you would prefer to wait in an in-person visit in the emergency room, then this is what you would see. So really it's around access. Did you want to add?
Yeah, just to add to that. And I think this was spoken to in the technical briefing, but in our test and try virtual care, virtual emergency NS, in 3 spots, but in particular where it started in Colchester, I think we've seen 1,300 persons virtually, and they have a choice. If they have low acuity, they have a choice. Would you like to be seen virtually? And there's a goodly number of the 1,300 that needed a prescription refill. And the time of the visit, end to end, was 63 minutes. So where we can, that's why there's such an emphasis on expanding virtual emergency for those exact reasons. And, I'll just add to it. I think it was also spoken to that the mobile clinics and the pharmacists too are taking a number of persons out of the emergency. And I just know from looking at the numbers last week at the mobile clinic in Yarmouth, for example, out of maybe 80 people seen, there were 30 who were there there for prescription refills. So talking about the pharmacy enhancements, it is so important because so it all connects together, which I believe is your point, Minister.
Could somebody walk me through, what does a virtual visit look like in terms of an ER?
So, so two things. First of all, what we have and where we go in 3 years, 5 years, 7 years could be completely different, but we're starting. And here's what the start looks like. If you were to go to the emergency in Colchester, you would have an opportunity to, depending on your assessment, so let's just say you were 5. So you would be asked, Karen, given your assessment, you could be seen virtually. And I say, well, how long is that going to take? Well, that will take maybe an hour or 2 hours. Okay, I choose that option. So I will be taken to a room where there will be a person, and the person could be an RN or an advanced care paramedic. And so they would be physically with me, and they would also have a technology which is connected to, it could be an ER physician, it could be another physician, it could be a nurse practitioner. And so through the course of the person beside me and the person with me through the technology, I'm diagnosed, I'm dealt with, and I'm out the door.
Sorry, Minister, it seems like everything you're announcing today is going to help the emergency rooms that are actually able to operate right now, but so many of them are constantly closing. What can we expect for those? Because then, if an emergency room is closed, it adds load to another one. So what can we expect to see on that side?
So we continue to work with the assets in communities, and they are different, is what I would say. So wherever we can keep an emergency room open, we do, but we also have an option now for urgent treatment. So urgent treatment are those non-urgent or non-emergency things that bring us to emergency rooms, like episodic complaints, sore throats, sprained strains, things like that. So we want people to have access to that in community, and when we stabilize with the workforce that we have, we can expand hours so people can understand more regularly and stabilize services in community. There are places we need to continue to recruit. Recruitment and retention, we cannot take our foot off the gas. We know that we need to bring more people to the province. Instead of constantly moving people around, it really is essential that we bring new people, new care providers to the province. So we're committed to doing that. So stabilizing community, rural community services is essential for us. And we can do that, 1, through recruitment and retention, and 2, through the urgent treatment centres. And enhancing primary care, making sure that we use those community-based pharmacies to their best and highest use, making sure that the teams are built around primary care providers in those communities. So it is a number of things that we need to invest in. Yes.
How can you use the expansion of the coordination center? I take it it's in Halifax now, right?
It is.
And so can you talk about that?
I sure can. So, and I'm looking forward to bringing you all to see it. So it is quite amazing. The we're taking, so there are 6 tiles or apps. The capacity expediter, I call the bed expediter. It's amazing because you can see in real time all the hospital beds in the HI and starting to be across the system. It is our plan to take just the bed expediter and to put it first in the regionals and then out, so that in every hospital where we have the bed expediter, you will be able to see what the bed situation looks like at that particular site. It's really important, and this is one of the things that the Canadian Association of Emergency Physicians noted in its letter, its open letter last week, which is basically beds. I receive information from doctors who might say, I can't see the beds. So how can I get the patient out of the emerge? I don't know where the bed is. And up until this point, it's been paper, it's been verbal. It's just not real-time data. So now it is, and it makes a big difference when the bed can be so screen in emergency room, person can see bed is available, and instead of waiting for someone to come down for a phone call, for a text, whatever, that bed can be accelerated.
Obviously, this is data that's in a computer program, right?
Data that we're pulling from.
So is there like an actual physical center that takes care
There
of
is.
this?
And not only do we have it, you will all be invited to come and see it very shortly.
It's in
Yep,
Halifax,
it
and
is.
you're looking at putting it out. Where immediately are you going?
We'll go to the regionals and then beyond.
Minister, we heard that there's a plan to put more nurse practitioners in emergency departments, but I'm wondering if that plan is contingent on recruiting more nurse practitioners, or will they be redeployed from elsewhere in the interim?
So I would say a bit of both. Nurse practitioners, you know, as many of us, as many healthcare workers, we have our own special niche sometimes of what we prefer to do and our clinical skill set. So nurse practitioners will be redeployed if their skill set is such that it's appropriate for the emergency room. And then, of course, we will recruit. And to Dr. Tomlin Murphy's earlier point, our scope is quite broad in Nova Scotia, and being able to admit to hospitals and ensuring that and discharge and ensuring that we have full scope is quite attractive to nurse practitioners. They're autonomous care providers, and so that is a real support and help for us in terms of bringing new people into the system. So I think it's a bit of both.
Minister Thompson? I'm sorry.
No, I was just going to add to that. Sorry. You know, it is exciting for a nurse practitioner because a nurse practitioner is able to do more than one thing. So, for example, we have a number who have spent from September on the mobile units, and you know they love it, and they love it because there's not a whole lot of red tape. They're able to see their patients very immediately. It's very efficient and effective, and they have a great deal of satisfaction just being able to see folks quickly, effectively, efficiently, and so they're enjoying it. So if you enjoy your work, you tell your friends, and when you tell your friends, it's a good way to attract people. So that is very important in a lot of the things we're talking about, trying to bring some of the, you know, job satisfaction back and some of the hope and optimism for the future. And, you know, although we have had very tragic circumstances over the last 2 weeks, there are such elements of hope in our system that I certainly want people to understand that it's there. It is there, and we can bring that to the fore together.
Are there going to be float teams at every ER, and at what point will that have been established?
It's ours, and so you know the direction's been given to here's the hours, make it work. So I think that frankly people will go to the most immediate times of a week that you know makes the most sense, and then branch out from there.
Mr. Thompson, I was just wondering with respect to Cumberland, other than being able to put a patient advocate in the waiting room right away, are there any other actions your government can take to increase staff or improve conditions in the makeshift emergency room there?
Yeah, so these immediate supports will help the staff that are working in the emergency room. We know that the staffing in Cumberland has been, you know, difficult, as it has in some other more rural centres for a while. So one of the things that was announced as an example is to support the community there in terms of the community recruitment fund. So recently there was a $2 million fund, and working with community, particularly the municipality, they have a recruitment committee there that's quite active, and looking at how we support community building to welcome new practitioners in. So we do continue to recruit there where we need to. We are using travel nurses, right, to support that team, as we are using other teams. So, or using travel nurses and other teams. So working very close with local healthcare leadership to do what we can to support in the immediate, yes.
Does this plan and this immediate work give you any hope that we will not see families grieving like the whole Thompson Snows?
So I would hope that the care will absolutely be ready, responsive, and reliable in our emergency rooms. So, you know, everything that we can do to support the care and comfort of patients and to support the ability of healthcare workers to provide effective, efficient care is a benefit to all of us. And so, you know, these actions are undertaken for that reason. We do expect that it will be support not only to Nova Scotians seeking care, but also to the clinicians who are delivering care.
We talked about this in the technical briefing, but can either of you talk about the changes that are planned to speed up the offloading of ambulance into emergency rooms, how that change is going to look?
So the team itself? Yeah.
Like there's going to be a doctor doing the triaging now?
It's not, so yeah. So I'll look to my clinician colleagues. If they need to correct me, I'm not above it. So I'll just say that right there. I'm a bit far from the bedside. But what that means to me is, so we have an emergency room physician who is really managing and responsible for the department in association with other colleagues. This float team, first of all, it allows for, you know, the nurse will probably do the things she always did when she triaged, but it allows for rapid initiation of treatment and assessment. So, you know, maybe there are people, as an example, who could go and wait in the emergency room waiting room as a result of that intervention and triage. Also, there are patients who, for whatever reason, can't physically go to the waiting room, but they can be cared for by a physician as they wait. So it doesn't mean that the triage score is any different, but because of their condition, perhaps they need a different intervention that can be led by the physician. And it also frees that physician to, again, not have the entire responsibility of the department like their colleague would. It also allows them to offset you know, a variety of different functions. So what I think will happen is that they will be a second set of clinical care providers in that emergency department, and given the day, it's always fluid and emerge. It's always a very fluid environment. That person will be used to the best and highest use depending on what's happening. Maybe that's looking at patients in the waiting room, perhaps that's triaging people immediately to you know, if in the event of a serious or critical event. So I think it's very fluid, but focused on having them at the very compressed times where we see the greatest amount of usage. Is that fair? Is that fair? Is that right? Okay.
Ambulance offload would certainly be their focus.
Yeah. Yeah. Does that help?
I'd like to just make a point as well, which is that, not on that specific question, but just generally, you know, what we're talking about here today, certainly, I mentioned in my remarks, the minister's remarks, comes about as a result of conversations with frontline workers, but many members of community as well. And, you know, even recently, I think it's been certainly reported that the minister and I had received a letter, a comprehensive letter from the NSGEU, which had a number of suggestions, and as well, MLA Elizabeth Smith-McCrossan has also had a number of suggestions. And while I wouldn't say that we just sort of take every suggestion and implement, I think you can see reflected in what we've talked about here today, you know, so elements of what others have suggested as well. So point being that, you know, we're all about the solutions, and if there's a good idea that we can implement quickly, we're going to do it. We've been pretty consistent about that. I certainly have been. The minister has been. And I'm not sure if you got the full extent of the fire hose, but we certainly did yesterday. And, you know, the premier's move faster. So we definitely know we're feeling it, and we're trying to do it. So, you know, we don't have every good idea, and we're open. I certainly am open, and I'm really happy that we're able to share some of this with you today. And I do believe there will be elements that you'll want to know more about, and I look forward to sharing. So thank you.
We are just going to move to the phone lines. I'll come back to you. We'll go to David Schumann with the Signal. Go ahead, David. David, are you there? Okay, we'll move on to Pat Healy with the Laker. Go ahead, Pat.
Hi, this question is for Minister Thompson. What's your message to Nova Scotians who might be in a health emergency that might be fearful of going to an ER after the 2 recent deaths and long waits?
Thank you, Pat, for that question. So I have said repeatedly that our pre-hospital emergency system, our paramedics in this province, and our emergency room staff are the finest that there are. And I want people to be assured that those healthcare providers, nurses, physicians, LPNs, paramedics, are trained and able to help, and people should seek the emergency care that they require, whether that's calling 911 or whether they feel that they, present to an emergency room. Those folks are working diligently and are skilled and capable, and I want them to seek the care that they need.
Pat, do you have a follow-up question?
Yes, I do. With the crisis that we're in, how did we get to this point? I guess what I'm saying is, why wasn't something done sooner before we got to this point?
So I think, Pat, we mentioned that earlier. We certainly in healthcare have been really decades of trying to contain costs, trying to look for efficiencies. I remember as a graduate nurse counting the number of things that we did in this work measurement tool to prove that we were working hard enough. And that resulted in staff reductions, and that was 30 years ago. And we felt that we had too many healthcare providers, if you can imagine it, and schools were cut back for nurses and physicians, and all the while talking about this population and how our baby boomers particularly would age, and how we would live longer with chronic disease. And so all of those things have brought us here. And so what's really important is not just investment, because there is no financial limitation right now. It's not a blank check, but we will invest in the infrastructure and the people. But we really need to transform the system and how we deliver care. And so there's a number of reasons why we're here, but we are committed to making improvements.
Okay, next we'll go to Ed Halverson with QCCR Liverpool. Go ahead, Ed.
Thank you. You talk about reinvesting and investing in people. I'm curious, have you looked to the people we have already as far as trying to expand the number of nurse practitioners we have? Is there any method or a methodology in place to provide funding or support for existing nurses who may want to upgrade their skills and become nurse practitioners?
Yeah, there is a variety of different incentives that we have through the provincial, through the nursing strategy money, as an example. We also are looking at how we support paramedics, and I do think it's really important that we show people a ladder if they want to progress in their career. It's also very important that we add more people. So, if people are progressing in their career, which is wonderful, and being able to work in a different way in the system, it's important. But we need to ensure that there are individuals coming behind them to fill the vacancies. So it has to be both. We need to give people a path, but we also need to recruit new people into the system in order to make sure that it's sustainable.
Ed, do you have a follow-up question?
I do, and it's the question I asked during the technical briefing, but I will ask it of the minister. What's being done to ensure we have very dedicated people who are in the system now? What are we doing to make sure we don't lose those people? How are we retaining them?
Mm-hmm. So, first, I think one of the things that's important is that we do spend a lot of time with healthcare workers, that we are visible, and that they have access to their leadership. And I've worked very hard, and I know Karen Oldfield has worked very hard, as have other people, to be present and implementing solutions so that folks have agency over their workplace. It's really important when teams have ideas and energy around something that they think will alleviate some of the challenges that they face. I think it's really important that we empower them to do that. So looking at workplace environments, we are always in contact with union leaders to talk about how best to support people. I know Nova Scotia Health has also started stay interviews about what are the things that support people in staying. And we do hear suggestions directly from frontline workers about different initiatives that would help them stay. So those are the things that are undertaken. Again, we know there's more to do, and we are committed to working with healthcare providers to support their environment.
Next, we'll go to Lois Ann Dort with the Guysborough Journal. Go ahead, Lois Ann.
Yes, hi. Thank you for taking my question. This is for the minister. I have seen nothing here to address the discrepancy in pay for physicians in rural EDs, which inhibits our ability to recruit doctors and hence keep our ERs open. According to Eastern Shore MLA Kent Smith, the master agreement between Doctors Nova Scotia and the province, a doctor at emergency level 4 site gets paid $77.18 per hour, while an ER doc at a level 3 facility makes $154.31 per hour. What will be done to address this?
So certainly those rates in the master agreement are negotiated between government and Doctors Nova Scotia, and folks can correct me. We don't really, as we would with other collective agreements, we work within the parameters of those. That's not to say that there's not more work that can be done, but those are the rates that have been negotiated and agreed upon, and so we need to continue to do that. But we are always open to, different opportunities going forward in terms of negotiations.
Lois Ann, do you have a follow-up question?
I guess that would be just when would the next negotiating round be open?
It's now.
Okay, we have time for one last question in the room, so we'll go to Paul.
The deputies put a ballpark figure on all this at tens of millions of dollars. Is that money you have in your budget for the current fiscal year, or does it require additional appropriations?
So I would say both. That there's some in-year funding that's happening. We're going through the budget process for next year. We're expediting, or accelerating some of the work. This is money that is allocated through the budgetary process, and we are committed to investing in healthcare. We know it's the most pressing concern for Nova Scotians, and we will continue to.
But as some of this is actually budgeted for next year, do you have the money in your current budget, or are you for it, or are you going to have to go back to the finance department for a little more?
We'll find it. We'll find it. I think what's important is that, what it does in some cases, you heard that some of these things are happening more towards the end of the fiscal year. So what it really does is shortens our runway in terms of being able to move it more quickly. But I just want to tell, there's an urgency required for this. There is an urgency required, and we want to make sure that we are doing the right things as quickly as possible. And whether that investment comes on the 31st of March or April 1st, what's important is that we are committed to delivering the services to Nova Scotians.
Okay, thank you very much, everyone.
Thank you.